Hello friends, I am Dr. Vinod Kumar. I am presently working at the Corporate Hospital Amritsar as interventional cardiologist. Today I am going to discuss with you pulmonary artery hypertension. Pulmonary artery hypertension is a rare disease which most of the clinicians don't know about it, and it remains undiagnosed throughout life. So I am going to tell some basic things about pulmonary artery hypertension so that there should be some awareness about the disease. So pulmonary artery hypertension is a disease in which there is raised pressures in the blood vessels of the lungs. Unlike it's different from raised blood pressure or blood pressure, we talk about blood pressure as such of a patient. It's different from that. So pulmonary artery hypertension is a condition in which there is either some problem with the pulmonary arteries or there is some problem in the heart which has caused increased blood pressure in the arteries of the lungs, and which subsequently causes symptoms and can lead to death of the patient. There are many types of pulmonary artery hypertension. Pulmonary artery hypertension has been diagnosed into 5 main categories, and one of the category which we call pulmonary artery hypertension, in which there is either blockage of the pulmonary arteries or they have become narrowed, which subsequently lead to increase in pressures in the pulmonary arteries, and for which heart has to pump harder and harder, and which eventually becomes weak and fails. So it's important to diagnose it early and start treatment in this condition. So what is the incidence of pulmonary artery hypertension? Although there is no data available from India, but it has been seen from studies that the incidence of pulmonary artery hypertension or pulmonary hypertension is around 8 to 10 cases per million per year in US and Europe, and probably the incidence is same in India as well. And usually what are the risk factors for pulmonary artery hypertension? Usually pulmonary artery hypertension is diagnosed in younger patients in second and third decade, and they are majority of the time they are females. And risk factors, if we talk about risk factors, it has been seen that pulmonary artery hypertension has got a family history. It has been seen that pulmonary artery hypertension develops to the patients who are taking some kind of drugs like weight reducing drugs, cocaine and amphetamines, and so it becomes very important taking history in these patients, or also patients who have got DVT in the past, swelling in the legs with clots, and that get embolized and they block the arteries of the lungs, and they can cause pulmonary artery hypertension. Now we will talk about what are the symptoms of pulmonary artery hypertension or pulmonary hypertension. Usually these patients remain asymptomatic from the start of the disease. For initial 2 to 3 years they remain asymptomatic, or they start with progressive dyspnea, shortness of breath, pre-syncope, syncope, fainting episodes, dizziness. They can have chest pain, they can have palpitations, and in the advanced stage they can have symptoms of congestive cardiac failure in the form of swelling of abdomen, tenderness in the abdomen, swelling in the legs and feet. So how to diagnose these patients? Usually taking a good history is very important. Patients who have got progressive dyspnea in a younger age group in females should consult a cardiologist, and they should take a good history, that whether there is any family history or there is history of swelling in the legs, and history of any drug intake in the past. And then your practitioner will ask for a battery of investigations in the form of arterial blood gases, DVT, pulmonary scans, some advanced tests in the form of catheterization of the heart, so as to find out pressures, how many pressures are there, and how to diagnose it and how to manage it. Usually we don't have any cure for the disease, but whatever modalities of treatment we have right now, they are just to decrease the progression of the disease. So treatment of the early diagnosis and treatment should be started as early as possible, and it has been seen that once we start the treatment, many patients live normal life, and treatment for the disease is lifelong, and you should get treatment, good treatment, and there are many drugs which are under research, and maybe in coming time we will find some better drugs. Thank you.